Okay, so this is cranial nerve test 1. So Jack, can you first have the patient go ahead and close your eyes, and then I want you to press against one nostril, close your nostril. Just try to smell.
Smells like lemon juice.
Okay, good job. Now you switch sides. Smell there.
Lemon.
And your cranial nerve 1 is good. Okay, this is cranial nerve test 2. Jack, have you had any recent vision changes?
Nope.
Okay. So after you clear that, you're going to go ahead and have your patient do a Snellen's test. So have them stand 20 feet away from a Snellen's chart, and then have them read line by line.
A, D, Q, M, S.
Okay. And then make sure you take note of any errors they had, and then you can go ahead and grade the Snellen's chart after that. Next, we're going to have the patient do the peripheral vision test. So first you have the patient sit 2 feet away from you. Make sure your eyes are at the same level. Make sure they're making eye contact with you. Have them cover the opposite eye that you're covering. And then we're going to test all 4 quadrants, 2 in each eye. So we start from the bottom bottom right corner.
Yep.
And then tell me, okay. And then top right corner, tell me when it enters.
Yep.
Okay. And that's the peripheral vision test. Okay, so this is cranial nerve test for cranial nerves 3, 4, and 6. So first you're going to have the patient sit. You're going to make eye contact with the patient. You're going to check their eyelid. It should cover approximately 1/3 of the iris. While you're doing this, you also want to check the pupils. They should be round, even, and in the center of the iris. So next we're going to go ahead and look at convergence. So you're going to have them look directly at this pin, and then you're going to move it in towards their nose. You should see them follow that cross-eyed pattern, and also you should see their pupils constrict a little bit. Then next we're going to do the pupillary reflex. We'll come out to the side, have them stare at an object in the wall. So Jack, can you stare at that corner for me? Then you shine the light in their eye. You should see both pupils constrict. Now the final one we're gonna have them follow the pin. So look at the pin right here, up, down, and we go left, right, and then we're gonna go diagonals. Good job. This is cranial nerve test for the 5th cranial nerve. So the first thing we're gonna do is go ahead and palpate bilateral temples and have them bite down. So you're feeling it should be even on both sides. You should feel a contraction. That's the temporalis muscle. You're going to do the same thing with the temporomandibular joint. Have them bite down, and he's good. So the next thing you're going to do is have them open their jaw. Okay, you're looking for deviation to the left or right. Then you're going to have them open their jaw again, and then you want them to move the jaw left and right. That's just testing for the pterygoid muscles. So the next thing we're going to do is just sensation. So go ahead and close your eyes, Jack. Just say off, on when you feel it. On right there. Then you want to test right here.
On.
And then you test right here, the corner of the
On.
mouth. Good job. Okay. The next sensation we're going to do is you want to just make it to where there's a little string coming off the cotton ball. And then you have them look up and away. And then you come in. And then they should blink both eyes like you just did right there. Great job, Jack. So then you're going to take our cardboard for us. Tongue depressor. And have it stick in the mouth on one side of the jaw. Have them bite down. Just lightly pull. Okay, that's good. So you do that for both sides of the jaw, and that is the 5th cranial nerve test. Okay, this is the test for the 7th cranial nerve. So first I want to have you smile with teeth. Then I want to have you frown. Okay, then I want to have you raise your eyebrows. Now close your eyes tightly. So you're looking for any asymmetries, so the sides should be even to the appearance. And that's the 7th cranial nerve. And you test for taste on the anterior 2/3 of the tongue with this. Okay, this is the test for the 8th cranial nerve. So what you want to do is you want to stand around 50 centimeters or about 2 feet away from your patient. So you're going to whisper a 2-digit number and have your patient repeat it. Jack, go ahead and close your eyes.
69.
Yep. Okay. So this is not a tuning fork, but it's going to play one on YouTube. So what you do first is you bang the tuning fork on the palm of your hand and it should get a vibration. So then you'll go ahead and palpate the mastoid process right here. Tell me when the sound stops.
Now.
Okay. Then you'll hold it about 3 centimeters away from the ear, and then tell me when the sound stops.
Now.
Okay, good. So that's that part. Make sure you do that bilaterally or to the other side. So then you take the tuning fork, bang on your hand again, and then you hold it right in the middle right here. And can you hear that? Tell me when you don't hear it in your right or left ear.
Now.
Okay. For right and left?
Now.
Good. Okay, and then the last part of the vestibular-cochlear test is going to be, I just want you to turn your head pretty fast to the right. Okay, yeah, that's good. And now the other way. Okay, so with that, you're just looking for nystagmus or rapid eye movements. Okay, so this is the test for the 9th and 10th cranial nerves. So the first thing I want to ask is, Jack, have you had any difficulties with speech or swallowing?
Nope.
Okay, so throughout this examination, you're going to listen for any sort of hoarseness in their voice when they're talking to you. The next thing I want you to do is just open your mouth as wide as you can, say ah. So you're going to take a gander in the back, and you're going to look for symmetry of the uvula and the soft palate on both sides. Then we're going to go ahead and do the gag reflex. So Jack, can you open your mouth again? So you just stick both sides. Okay, so you're good?
Yeah.
And that's the 9th and 10th cranial nerve. Nerve 9 and 10, if you see an absence of the gag reflex, you'll have to test for taste on the posterior 1/3 of the tongue. I have a solution here. So Jack, open up. And then I'm just going to... Okay, this is the test for the 11th cranial nerve. So we're going to be testing the SCM and the traps. So what you want to do is you're going to feel the SCM right here, palpate on the opposite side, and you're going to push into your hand. Just turn their head into your hand. You should feel a contraction. So you're going to test both sides. Great job. Okay, then right here, you're going to have them go ahead and shrug their shoulders against your force, and great job. Okay, so this is an assessment for the 12th cranial nerve. First, you want to assess the patient's speech by having them repeat back a simple sentence. So Jack, can you repeat, I like PT?
I like PT.
Good job. So then the second part of the test, you want to have the patient stick their tongue straight out, okay? And you're just looking for deviation from side to side. And he doesn't have any, so his cranial nerve 12 is good.